Hey, it's your afternoon girlfriend, Yvonne Daniels. Happy Friday. Man, I tell you what, I hope you're having a great day. And I am so just honored and just happy to be going live with some great people we're going to be talking about another COVID-19 pop-up testing site. So let me just bring my guest on. We have got Miss Angela Williams, who's the Director of Special Project with Great Lakes Bay Health Center. How you doing, Miss Angela?
How are you?
Fabulous. I've got Dan Sosa, who is the director of the Samaritan's Community Center. Hey, Dan, how you doing?
Hello, how are you?
Good. And Antoine Martin, yay, is able to join us on in here. He is the HIV prevention manager at Great Lakes Bay Health Center. So how you doing, Antoine?
Hey.
Hey. So I tell you what, I cannot believe that it's almost September and we started this pandemic back in March. And, it was only supposed to last 2-3 weeks tops. Like I said, we're going into September and we're still seeing numbers. They're decreasing in some areas, but in a lot of areas, they're not. As we were talking, Angela, a little earlier, you're saying that there's still miscommunication. So we just want to make sure that people are getting the right information, that they are getting tested. We know that that is very, very critical. And so that's why you all are making these COVID-19 pop-up testing sites available for people. So we're going to just dive right into it. And let me just tell you, too, if you have any questions out there as you're watching, please just put your questions in the comment section, and we will be happy to get to those. Any questions that you have. Also, before we get started, the COVID-19 pop-up testing site is going to be going on this Tuesday. It's going to be at the Holy Family Catholic Church. You can see it right there as it's scrolling by at 1525 South Washington Avenue. So that's this Tuesday, 2 to 5 o'clock. All right. So Miss Angela, we want to get into, like you said, I cannot believe that people are still not getting the information they need, but who can actually be tested?
Anyone can still be tested for COVID. One of our challenges is recognizing the need of educating our community on COVID, increasing the awareness of the need to get tested. And also, as Great Lakes Bay Health Centers, we are cognizant of the fact that some people don't have access to getting downtown to our drive-through or walk-through area that we've been hosting testing since March. And so we created the pop-up testing sites as a result of the state of Michigan identifying the prevalence of COVID being higher in the African American and Hispanic communities. We are so happy today and pleased that we are hosting this pop-up event on Tuesday, September 1st with Latinos United for Saginaw. We have been communicating with Hispanic leaders and gaining an understanding and assistance and support in identifying measures and appropriate messaging to get the word out as to how important it is to get Hispanic neighborhoods engaged in understanding the importance of getting COVID tested.
All right. So with that being said, too, and I've been hearing some things, but I want to get it from you or Antoine. So why should people get tested?
Yeah. So as we know with COVID-19, you don't always show symptoms. And so you could be carrying the virus and spreading it and not know it. And so we want to encourage people to get tested for COVID. That way they know their status and they can make, the appropriate precautions to, protect themselves, protect their family, and protect their community. Especially for those individuals, let's say, who are going back to work or who've been working like on the front lines or they're, engage a lot of people. We really want to encourage them to get tested.
And, and you say that, but also we're hearing about, I have been hearing commercials and they sound like young people, they're like, man, I went to this party and it was lit. But I think I got Rona and I took it back to, my grandma and I think I lit up the whole house. So, it's sad to say, but even people that are out here that are doing things that are not being obedient, wearing their masks, social distancing, they too should be probably getting tested so that they're not infecting the entire house as well, right?
Right. Yes. And so the statistics have shown recently that the higher prevalence of COVID now is in young adults, age 20 to 29. And I noticed the other day that Michigan is releasing all of these advertisements about Rona.
Yeah.
It's about wearing a mask, proper hand washing, and social distancing. And I think that's appropriate at this time, that the messaging be emphasized because COVID is not gone. It has not gone away at all.
No. And it's sad to say, but I don't see it going away. I would hope that it would go away, sooner than later. But until people begin to do the things that they've been saying that we need to do, all along, we're probably going to see this, and people are going to continue to need to get tested. So according to recent news updates, CDC has released new guidelines for testing. So does this affect the testing practices for Great Lakes Bay Health Centers?
No, it does not affect our practice. We will continue to follow our current policy for testing until we receive an official statement of clarification from CDC. So to reemphasize, as Antoine said earlier, anyone who feels the need to be tested is able to be tested through our organization.
All right.
There's no discrimination. There is no question asked. Come to the drive-through or walk up and you are able to get tested.
Which is going on this Tuesday at the Holy Family Catholic Church, 1525 South Washington. All right, 2 to 5 o'clock this Tuesday. I'm going to be hanging out there as well. So, all right, so some research is saying that men are more affected by COVID-19 than women. Some folks may not want to hear that, but that's what it's saying. So why is that exactly?
So it is statistically a fact that more men are dying than women from COVID-19. But that's because men have a higher instance of heart disease, high blood pressure, liver disease. It's just more common amongst men. Some of men's behavior, such as being the primary breadwinner in the family, it means that they have to go out more. Men are more likely to attend sporting events, shake hands, that sort of thing. And also attitude. Studies show that men's attitudes are a little more lax when it comes to some of these health-related issues, which all lead to a higher rate of COVID-19 infection.
All right.
So should we say that we should be trying to get the women to get these men to do better and should get tested as well, for sure.
We need to make whatever effort we can to get people to test. So if it means the wife is pushing the husband to go or the significant other, whatever works, we are there to serve, okay?
Most definitely. I hear that. Okay. So why exactly is it important for racial and ethnic minorities to be tested for COVID-19?
So we know for racial ethnic minorities, we're being mostly impacted by the COVID-19, mostly because we typically, I won't say typically, but many racial ethnic minorities have underlying conditions like diabetes, heart disease, and lung disease. And if you have one of these diseases and get COVID-19, your risk of experiencing some of the more severe symptoms of COVID-19 are that much more likely to occur. And so we do know, like, for example, for Hispanic and Latinos, being hospitalized is what 4.6 times higher for them in comparison to whites. And so, and as of right now, we know, like in the state, Hispanic and Latinos are being disproportionately impacted by COVID-19 because they only represent 8% of the entire population in Michigan, but yet they make up 5% of the COVID cases.
Wow.
So
Wow.
it's a big concern.
Yeah.
Actually, you reverse those. It's 5% of the population, but 8% of the COVID cases. So it's higher than our population.
Sorry. Yeah. Thank you for the correction.
All right. So, and I've been hearing people talk about this, especially since we're so far into it, as far as, being tested. So clarify this for us. How does the testing actually work?
Well, the testing at Great Lakes is a drive-through, or like we said, you can walk up and get tested. Overall, you stay in your car. The staff will take some demographic information and your insurance information. They will follow all safety guidelines when they approach your car. And we have a new testing procedure, Yvonne, since the last time we did this.
Cool.
Procedure is very easy. It uses a nasal swab that collects a sample from your nose. They place a small Q-tip in each nostril, only takes a few seconds, and you can actually perform the test yourself or be watched by one of our testers. The small swab is very simple, it's not uncomfortable, and you'll be contacted by one of our staff within a few days with your results.
And I think that's so cool that people are being allowed to do it themselves, being watched by someone, because I think that sends the comfort level up a little bit, which you probably will get more people being tested if they know that they can kind of do it themselves and they won't be impaled or won't be, harmed or it won't hurt or sting or whatever. So.
And it's much simpler than the original test that we were using. That one was more invasive, where it almost made you choke because it went farther down the nasal passage. And this one, I was so surprised because I've been tested quite often, and this one is very easy, convenient, and simple. So,
and will that one be available this Tuesday?
That one will be available on Tuesday.
Yay! Okay. All right. Excellent. All right. So, what does someone do if they test positive or are confirmed to have COVID-19? What then?
The recommendations from CDC is that you stay home, avoid public places, and you should quarantine for at least 14 days to reduce your exposure to other people. Avoid any public transportation, monitor your symptoms. If your symptoms get worse, you need to call your doctor right away. Get rest, stay hydrated, and before going to a healthcare appointment, you should call ahead and tell them that you have COVID so that they take the appropriate screening precautions. Again, we're going to reemphasize that you always have to wear a face covering, a mask, cover your cough, wash your hands, clean your hands with hand sanitizer if you don't have soap and water available. And in your home, stay away from other people as much as possible. Avoid sharing personal items in your household like eating utensils, making sure that you are disinfecting everything and cleaning your surfaces as much as possible. And we encourage anyone who's tested positive to please communicate with your family or household members. Have a plan in place to avoid and reduce the risk of someone else catching COVID from you.
All right. Got to be vigilant about that for sure. So, and people are really happy, of course, when they get a negative result. But what does a negative test result actually mean?
So if you get a negative test result, it means that you don't have the virus currently, but don't be too happy because it does mean you can still be infected in the future. All right. And like I said, you can be infected and not show symptoms. So regardless, that's why we say it's still important to practice those social distancing, wearing the face mask when you're outside amongst people, or if you're indoor with a lot of people, and also making sure that you're washing your hands more frequently than I would say usual. And then another good thing too is to wipe down areas where people are prone to put their hands or have contact.
I know I visited my mother recently, and I've heard other people that say that when they go grocery shopping, they actually have, I know my mom does dishwater with Clorox, and she gets it all out and she wipes down every single thing when she goes shopping and brings it into the house and everything, before she puts it up. So talk about being vigilant. So
that's good.
Yeah, I think so. It's work, but I'm not mad at her, and I kind of started to incorporate that myself. So, it's interesting too. Just a quick question that I had. So, how often would you encourage someone to be tested? And we're talking about those people that are essential people that are on the front lines. Once every couple of weeks. I mean, is there a time, amount that they should be tested?
So our policy at Great Lakes is more related to especially essential workers. If you feel the need to be tested, if you think you have been exposed to someone with a possible positive test, then you can get tested as often as necessary. But we just ask everyone, use your own, as a healthcare personnel and those in the front line, you have to kind of make that decision on your own. We don't have a concrete policy saying everyone should get tested every 2 weeks. If I were to travel in a hotspot area where I know in a city where there were a lot of crowds that I tried to avoid, but I had no choice, me as a nurse and as a person, I think that I would be more proactive in getting tested so that I would be more conscientious of, okay, if I am positive, I know I need to take these measures to protect my friends, protect my family, and protect my workplace.
Right. All right. Good advice. All right. So, according to the Michigan Department of Health and Human Services, there's an alarming rate, and we've been hearing about this racial and ethnic disparities in COVID-19 cases and deaths. Like Dan kind of corrected there, Hispanic Latinos make up 5% of the Michigan population, but account for 8% of COVID-19 cases. So, why is it important to bring COVID-19 testing and education awareness to our community?
Well, the reason it's important is to address that disparity.
Mhm.
With providing culturally appropriate messaging, we're more likely to get people to want to be tested or be willing to be tested. There's a lot of fear out there in our community, and that education is the best way to combat it. So that's why we're utilizing different venues such as social media, local churches, local community organizations, and centers to get the word out about this testing, because folks are really limited in the interactions now that they have with groups like schools, and our interactions are cut down so much. We have to these organizations to be able to get people out. So this education has to happen through kind of a very grassroots means. So the social isolation and quarantine that people are going through is really not conducive to getting people out and getting people wanting to be tested.
Right. All right. So, and education is so crucial because that's power. So
as well as the location, there's the location is right next to one of the Mexican American, the Mexican American Cultural Center, which is a pretty active community partner. So people in our community are familiar with that facility. They're familiar with the location next door to that, where the testing will be. And so hopefully it'll break down some of the barriers and reservations people have and encourage them to come on and get tested.
Which, once again, cannot stress it enough, is this Tuesday, 2 to 5 o'clock at the Holy Family Catholic Church, 1525 South Washington. They're going to be out there from 2 until 5 o'clock. And as Angela Williams has stressed, got a new testing method, which you can do yourself. Someone can watch you. And so, won't be as uncomfortable. So those are all just positives. So this is not a positive, but what are the risks of COVID-19 infection?
Well, you want to go ahead, Antoine. Sorry.
Well, so we know, like, for those who are high risk, kind of like how we talked about earlier, it's those individuals that are typically older, have underlying diseases like diabetes, high blood pressure, heart disease, kidney disease, and so forth. But that just means you're at higher risk. Doesn't mean that there's no risk. So anybody can get this virus. I want to stress that anybody can get this virus. And just because you're young doesn't mean that you won't experience symptoms or get some of the severe symptoms. So I just want to reiterate that. And one of the things that we do say is that, if you do feel sick, and you start feeling some of those severe symptoms like a fever, a dry cough, difficulty breathing, you're tired, aches and pains, runny nose, nasal congestions, all that, make sure you contact your primary care provider ASAP. Don't postpone. Especially when we talked about men, they're like, oh, I don't need to go to the hospital or anything. I'm fine. Like, I just need to, sleep it off or whatnot. No, take it serious.
And go see about it. So talking about that, how can people find help to stay safe and healthy during this time?
So we are fortunate at Great Lakes that we collaborate with many other community agencies. And so 211 is a primary resource in the community right now that is helping to spread the message in reference to statewide resources, including COVID testing, as well as if you have a need for food or diapers, rental assistance, call 211 and they can help you. Some of the other measures that we encourage the community to take as actionable steps includes, you got to stay informed about COVID. You see it on the news every day, but you have to be proactive and learn on your own. Yeah. Don't stigmatize people by saying, oh, they were positive for COVID, or they got the COVID. Our goal is to demystify this. This is a healthcare concern. It's a public health pandemic. We're making as many efforts as we can to educate the public, do not put off your medical or dental visits. You have to call before you show up at any of those appointments, no matter which, either you go private or public places. You need to call in advance. We are a primary care provider for more than 56,000 patients at over 30 locations as a part of Great Lakes Bay Health Centers. And we provide medical, dental, and behavioral health services, regardless of what your insurance status is, or if you are not insured. We're taking as many safety protocols as possible to provide either telehealth or face-to-face visits if necessary. We are limiting the amount of people in the buildings and facilities just to keep everybody safe. One thing that we didn't mention, Yvonne, is that we are going to offer HIV testing at this pop-up site. This will be the first time. We know that the statistics are going to show, because of social isolation, the STD rates, the rate of pregnancy, as well as HIV, has to have drastically increased during this time of isolation. So we are taking measures to provide access for HIV testing. It would only take 20 minutes or less with a swab that can get themselves swabbed as they're waiting. So we are trying to do everything we can to make these services as convenient as possible for our community. We care about our community, and we believe in quality care for everyone.
And thank you so much for making this available. And for both of these, HIV testing and COVID-19, people need to know their status. So making that possible. Once again, this COVID-19 and HIV pop-up testing site is going on this Tuesday. It is going to be at the, scrolling by here, Holy Family Catholic Church. Once again, that address is 1525 South Washington, 2 to 5 o'clock this Tuesday. So come on out, know your status, get tested. I thank you guys so much for my guest for coming in and joining me and talking about this, because education is just so needed. Thank you, Alexandra. Says we appreciate all you're doing to help our people out. So, and we appreciate you for watching and getting this information. So once again, to Dan Sosa, the director of Samaritas Community Center, thank you. Antoine Martin, the HIV Prevention Manager, thank you. And Angela Williams, Director of Special Projects for Great Lakes Bay Health Centers, thank you. And we will see all of you out there as we get tested this Tuesday, all right, at the Holy Family Catholic Church, 1525 South Washington, 2 to 5 o'clock this Tuesday. So if there's nothing else anyone wants to discuss, anything else that we missed?
We just would like to ask that you spread the word to your friends, your family, and take advantage of this opportunity. A lot of work goes into this effort, and we know that it is essential that we provide this service to the community.
Yes. And one way you can do that too, as you speak of sharing, is you can share this YouTube. This is on our KISS 107.1 Facebook page and our KISS 107.1 YouTube channel. You can share it. You can have family and friends come back and watch it as well if you miss any of the information. But thank you all so much. We'll see you on Tuesday, and everybody have a great day.
Thank you.
Thank you. All right.